Thank you all for being here today. My name is Hamid, and I will be your trainer for this session on HIPAA, privacy, and security compliance. Whatever you are, a healthcare provider, an administrator, or a business associate, understanding HIPAA is essential for protecting patient information and ensuring compliance with federal regulations. Throughout this training, we will cover key HIPAA rules, including the privacy rule and security rule, as well as HITECH Act and Omnibus Rule updates. We will discuss real world scenarios, compliance best practices, and how you can help safeguard protected health information or PHI in your daily work. This training is designed to be interactive, so feel free to ask questions at any time. Let's start with the basic what is HIPAA? The Health Insurance Portability and Accountability Act was enacted in 1996 to address several healthcare challenges, including ensuring the privacy and security of patient information. HIPAA applies to covered entities such as hospitals, clinics, insurance providers, and also to business associates who handle patient data, such as billing companies and IT vendors. HIPAA is not just about paperwork and legal compliance, it directly impacts patient trust. Patients expect their health information to be protected, and it is our responsibility to ensure that it is handled with care. The privacy rule is one of the most well known parts of HIPAA. It protects all forms of protected health information, spoken, written, and electronic. This means that patient names, medical records, test results, and even billing information are all protected under this rule. Under the privacy rule, patients have several rights, including the right to access their medical records, request corrections, and control who their information is shared with. Our job is to make sure that we follow these rules and do not disclose patient information improperly. For example, if a patient calls to ask about their test results, are we allowed to share the information over the phone? Yes, but only after verifying their identity. What is a family member calls? What if a family member calls? In that case, unless the patient has given prior authorization, we must be cautious and not share any details. While the privacy rule focuses on who can access patient information, the security rule ensures that electronic protected health information is kept secure. This rule applies to computers, email communications, and any digital storage of patient data. There are three main safeguards required under the security rule. Number one, administrative safeguard. Policies and procedures that control who can access patient data. Number two, physical safeguards. Measures like second workstations, locked filing cabinets, and restricted access areas. Number three, technical safeguard. IT protection such as encryption, firewalls, and access controls to prevent unauthorized access. For instance, imagine You receive an email that looks like it's from IT asking you to reset your password by clicking a link. What should you do? That's right. Do not click the link. Phishing attacks are a major threat to patient data security, and it is crucial that we verify any request before taking action. In 2009, the HITECH Act was introduced to strengthen HIPAA protection, particularly for electronic health records and I repeat, particularly for electronic health records. The Omnibus Rule added in 2013 expanded HIPAA to include business associates and added stricter penalties for violations. One of the key updates was the breach notification rule, which requires organizations to notify patients and authorities if their health information is exposed. Uh, this means that if a laptop containing unencrypted patient records is stolen, the organization must report the breach and take action. To prevent breaches, we must follow best practices such as using strong passwords, encrypting sensitive data, and ensuring that patient records are only accessed by authorized personnel. Now, let's talk about what happens if HIPAA rules are not followed. The consequences of HIPAA violations can be severe. Fines can range from $100 to $1.5 million per violation, depending on whether the violation was accidental or due to willful neglect. In some cases, criminal charges can be filed, leading to job loss and even imprisonment. Real world cases show serious HIPAA compliances. For example, in one case, a hospital employee accessed patient records without authorization and was fined and fired. In other case, a doctor's office improperly disposed of medical records, leading to a significant financial penalty. These examples highlight why we mistake HIPAA seriously every day. So, what can we do to ensure we are HIPAA compliant? Here are some best practices to follow. Always verify patient identity before sharing information. Do not discuss patient details in public or unsecure locations. Lock computer screens when stepping away from your desk. Use strong password and never share them with others. Be cautious with emails and links to avoid phishing scam. Report any suspected breaches or serious security concern immediately. HIPAA compliance is not just the responsibility of IT or management. It is everyone. It's everyone's responsibility. By following these best practices, we can protect patient privacy and avoid costly violations. To wrap up, HIPAA is essential for protecting patient information and maintaining trust in the healthcare industry. The privacy rule ensures patients' rights to control their health data. The security rules protects electronic health records, and the HITECH Act and Omnibus Rule have strengthened enforcement. As a healthcare professional, we must always prioritize patient privacy and security. Thank you for your attention today. I have loved to hear any question or concerns you may have. Let's discuss.